I'm Dr. Kim Porto, a local physician and board member of the CARES Eating Disorder Care. I'm here to discuss the use of medications with eating disorders. About half of the people that struggle with eating disorders also suffer from psychological conditions like anxiety, depression, and OCD. If they have anxiety, it was often actually present before the eating disorder developed. And that can be from genetic predisposition to temperament to the conditions they live in, and definitely from past trauma. If depression is present, it often has developed while the eating disorder is already at play. Either way, both of these can make recovery difficult. The symptoms of anxiety include racing thoughts, irrational fears, irritability, and frustrations. The symptoms of depression can include sadness and hopelessness, shame, but also apathy and difficulty concentrating. As you can imagine, when these are present, the road to recovery is often much more difficult. And that is why when we treat them, it's truly an asset. It's like having an extra tool in your toolbox in order to fight this battle more effectively. It helps you to come to this battle, to this road to recovery, with your full potential, not paralyzed by fear or numbness or thoughts, and able to listen to your therapist and to their coping skills that they are recommending, as well as some of the trauma work that might need to be done, some of the dietary choices that need to be made, and probably most importantly, some of the spiritual truths that you hear. Being able to actually be present with those and listen when you're told that you are worthy and that you can have hope in Christ. The medications we use are called SSRIs, selective serotonin reuptake inhibitors. And basically, they just help keep your serotonin around a little longer in your brain. It's already in your brain now. They help us with our mood, and the medicine just keeps them around a little longer. It's not unlike using insulin to help your pancreas and treat diabetes, or using thyroid hormone when you have hypothyroidism. It's just the chemical that happens to be in your brain and works with your thoughts and your emotions and your perspectives. I strongly urge you to consider talking to your physician about these. Sometimes you have to try a few different ones or a few different doses. They're not perfect, but they truly can be a strong tool as you walk on this difficult road to recovery. I want you to have hope, and I feel like this may be one of those keys.